So it's all
Awesome.
yours.
Thank you so much. Good morning, everyone. I'm Marie Calle. I am a pediatric oncology behavioral health therapist, one over at Life with Cancer, as you heard. So a little bit about me before I get into what Life with Cancer is, what we do. I am a local. I mentioned at the beginning of the call, my family is here. So I love your organization and I've heard a lot about it. So I'm very excited to be here today. I got my master's in clinical mental health counseling from George Mason University. I actually graduated about this time last year. So I was an intern with Life with Cancer for my final year of grad school. And then they decided to keep me and hire me onto the pediatric team. So I've been working full time here for about a year. And on the pediatric team, we focus on either parents who are diagnosed, children who are diagnosed, and kind of seeing those caregivers or those children. However, we do have adult and pediatric services at Life with Cancer, so I'll be talking about both. But that's where the pediatric comes, that I focus with families and young children and young adults and things like that. So I'm going to attempt to share my screen. I think we've all been here before, right? Where something goes wrong, even though we test it. So let me know if there's any issue. But we
Looks
will
good.
go. Yay. Oh, good. That's a strong start. May is going to be a great month because that started off correctly. Thank you so much again for having me here. This is a presentation about Anova Peterson Life with Cancer. You all might have seen the news that we did receive a gift recently from the Peterson family. So while we are affectionately known as Life with Cancer, and you'll hear me throughout this presentation just saying Life with Cancer or LWC, our full name is the Anova Peterson Life with Cancer. So what is Life with Cancer? Over here is our beautiful, what we call family center. This is the build. I'm sitting right here, right now in this office. So we are a nonprofit arm of the Anova Shar Cancer that provides education and psychosocial support to individuals impacted by cancer. So this is the Shar building. Some of y'all might recognize that was built off of Gallows. And our services are offered at no cost, not only to Anova Shar patients, but also to patients across the DMV. So I'll go more into what our services are, but here are just a few pictures that kind of highlight some of our services that go on. So here at Life with Cancer, our mission is to enhance the quality of life of those affected by cancer by providing evidence-based education, support, wellness programs, and initiative therapies. So what does all that mean? So what that means is that all are welcome, all ages, all walks of life. We're open to all ANOVA and non-ANOVA adult and pediatric patients, caregivers, and when I say caregiver, that means anyone who takes care of someone who has cancer. So that could be a family member, a friend, you're considered a caregiver, and loved ones. So on the pediatric end, that includes children who have a parent with cancer, maybe parents of children with cancer. On the adult end, couples, individuals, and this is all from your first diagnosis through if there's grief and bereavement involved, as well as survivorship. So all of our programs are free, including exercise, support groups, stress reduction, symptom management, educational offerings. And then like my team, we offer therapeutic counseling. So that's therapy, like talk therapy. We also have nurse navigation, which I'll explain a little bit later, and nutritional consultations that are provided at no cost for anyone who comes to Life with Cancer. There are some services that we provide in partnership, and so those might include a fee or have a certain number of services. I can explain some of those later, but anything that's like in-house is free of cost. It's not through insurance, anything like that. We have in-person and online availability. So we are in person at a lot of Anova campuses. So the Fairfax Hospital, the Shar building, that's also across the street from the Fairfax/Falls Church Hospital, Alexandria, Fair Oaks, Loudon, and then of course virtual or online that we're able to provide these services as well. Our team is made up of a lot of people who make it all happen. So we have oncology nurse navigators, and those are nurses who provide education, at the beginning of diagnosis, maybe pre-surgical classes, things like that. Clinical therapists such as myself, and the adult team as well, certified dietitians, certified fitness instructors, and certified art therapists. So we've got a lot of people who know what they're doing over here. And as I mentioned before, we're community funded. These programs are able to be offered at no cost, because we are philanthropically funded by generous donors in the area. So we're very grateful to them and everyone who provides support so that we can keep supporting our community. This is a whole, there's a lot of things that we offer. So I tried to summarize here. So we have teammates across all of those campuses I listed, and we do things like crisis intervention, helping with adjustment to illness. So someone just got diagnosed, and that's so life-changing when that happens. And so helping with that adjustment. We always used evidence-based practices, which I can talk about a bit later. We provide psychosocial support, so therapeutic support for anxiety, depression, brain fog, which is often a side effect of a lot of medications that someone takes when they have cancer, fatigue, and other symptoms that interfere with treatment and quality of life through a cancer journey. So we use a distress screening tool that patients use to indicate distress, and they can either see someone on our team, or we also provide community referrals if it's more appropriate for them to be seen by someone in the community. And if someone is referred to our team for counseling, we provide free short-term counseling, typically around 8 sessions, but everyone's different. And those sessions are cancer focused for patients, caregivers, children, family members, all of that. And then, as I said earlier, we have our nurse navigators who provide support to patients through pre-surgical education classes, post-hospital adjustment and care coordination. Our nurse navigators are incredible. They have so much knowledge, far more knowledge about cancer than me. So a nurse navigator is the right person to ask specific questions to. And we're proud to have a team who takes each patient's individual circumstances into consideration when providing care. So cancer impacts everything from our bodies to our minds. So Life with Cancer also provides nutritional support from our oncology certified dietitians, fitness classes, oncology massage, acupuncture, and energy therapy. So these are all things that are provided down there. That's a picture of our fitness area that we have here in the family center. We also have a psychiatrist on site who, via referral, can assist with medication management for Novachar cancer patients. And we also have a robust list of programs available, and those include children and teen education, support groups, art therapy, pre-op classes, yoga, cancer-specific education, support groups, and the list goes on and on. We're always developing new programs, and I'll share a little bit about that later. So as I mentioned earlier, and I'm trying to fly through so that we have time for a lot of questions, so feel free to stop me if there's any questions that need explaining. But at Life with Cancer, we try to use, evidence-based programs to address needs, and we use nationally recognized standards to ensure the best patient care. So there's a lot of people doing a lot of research here all the time. So these are just a few of the standards that we use. We provide world-class psychosocial and comprehensive oncology care. That's reflected by the standards set out by the Commission on Cancer, National Comprehensive Cancer Network, the Society of Integrative Oncology, and the American Society of Clinical Oncology, and the American Institute for Cancer Research, among many others. So we always want to stay up to date on our research and making sure that we're providing the best care possible. So I'm not going to go through each of these programs. You can kind of glance over. These are just the new ones we started last year. We have a ton more. And this is in addition to groups that we already have. Like, for example, on the pediatric team, we have a class called Curious About Cancer. That's a 5-week course for children like ages 8 to 11. And that's where we kind of teach them about cancer, cancer treatment, so they can understand their parent or siblings or family members' cancer better. But then they also are in a room of their peers and can see that there's other people their age who get what they're going through. And I think that's really an important part of support group is just feeling like you're not alone. We also offer Good Grief, which is a grief support group for adults who lost an adult family member to cancer. So, you know, if there's a bereavement and you're looking for support in that area, we have that. And we also have a couples communicating about cancer program. We know that a cancer diagnosis is really rough on people going through it within the same household, within the same family. So just ways to communicate with each other better. We even held special events. We had a healing through art therapy art show where they hung up art from patients who gave permission for that. And it was a really powerful day. We get toy donations around Christmas, and the whole building is filled with toys for families who might not be able to afford, you know, buying gifts for winter holidays. And then we also hosted a pediatric memorial service in collaboration with the hospital. So we recognize, much like you all, that we could not, the work we do could not be possible without the outstanding community around us. So in order to better serve our community, we have a cultural humility committee. We host community events, fundraisers, health fairs. We partner with third-party collaborators. So that could mean collaborating on patient resources like you see here, or donating our space to community organizations like the DC Candlelighters. So we're also happy to provide speakers for events such as this. That's very inception-y that I'm saying that while I'm here, as well as bring in guest speakers for events like we had a community lawyer who was offering an estate planning class for patients at no cost. So that's really cool to have those guest speakers. And our volunteer program is currently growing. We're happy to have a member of our team connect with you to see if your gifts and passions can be utilized on a volunteer basis through Life with Cancer. So if you're interested in that, you can email us I'll put it in the chat at the end, all of the contact information, but it's pretty easy to remember. We're just lifewithcancer@inova.org. And a member of our team can connect with you. So, I mean, we like to have fun. We'll do like Zumba classes. We'll do, this is like I believe out in Clifton, there's like a car show. So we'll go out and have staff out there, and we always have furry friends with us too. So we like to connect with the community and have fun as well. And so now I know I just flew through that. So I wanted to open up the floor for questions. I do want to put out the caveat that I am not a doctor, so I can't answer like oncology specific questions, but I can answer questions about like Life with Cancer and the services we provide. So I wanted to open up the floor for that if anyone had any questions.
I wanted to ask, how big is your staff? It sounds like you've got a million moving pieces. How many people are there?
Yeah, that's a great question. So that's always changing because we are like hiring more people as we get more funding. Right now, our pediatrics team is, I believe there's 10 of us on the pediatrics team, but that's spread across. We have pediatrics in the clinic, we have pediatrics in the hospital, we have pediatrics here. Our team is huge. I actually don't know the current count right now, but we can always use more hands. There's always people to help and people to serve. So, I mean, our staff includes those nurse navigators I mentioned. There's at least one at each site. Those therapists that I mentioned. We also have Spanish-speaking therapists who help with Spanish-speaking patients care. We have our fitness team. We have volunteers who come in and teach those classes as well. So we're kind of a mighty force with full-time staff and volunteers. But yeah, it's pretty big.
One of the things that I saw mentioned on one of your slides was oncology massage. How does that differ from a regular massage?
Yeah, absolutely. So our massage therapists who do the oncology massage, like they understand you know, how to navigate if someone's had a surgery, if there's a particularly sensitive area, maybe if there is a Metaport placed, things like that. So they're extra sensitive to you know, those areas that might be impacted by treatment, and they communicate with the patients as far as that. So they can specialize in that, or if someone says, I'm feeling this certain pain because of this treatment or anything like that. They specialize in that.
Okay, what are the different cancer education classes that you offer, and are they online or in person?
Yeah, so it's kind of like as needed, right? So if there's a huge demand about that, most of them are offered online now, so that people can do them on demand. So for example, I teach a course with the pediatric team called like Where to Start, which is about teaching parents and caregivers how to talk to their child about their cancer diagnosis. So how to communicate that. So that's a class that we teach, about age appropriate communication. There's classes about, kind of like, I just got diagnosed, like now what, sorts of things. And those can be within each different diagnosis. So when we see a demand for it, we typically have a therapist who is able to speak to that, or a nurse navigator who's able to speak to that. So yeah, those are kind of on demand. We're working on trying to get at least on the pediatric team, those classes like recorded so that people can go look at them before our next one. But there's always a course going on. And I can put in the chat too on our website, events.lifewithcancer.org is where those offerings are, those all free classes and offerings are. And then if you're looking for one, you can just like search that diagnosis or search that topic and it'll tell you when the next one is. Yeah.
Are they typically in person or online?
Typically online, we're able to offer them. I do know that some will do like a hybrid, but it really just depends on kind of the interest level and how many people, and if people have said, I want it online, that sort of thing. So typically online. Our support groups have gone back over to being a split between in-person and online. For a while, of course, we had to be exclusively online, but now we're getting back to where people want to see each other in person and feel safe doing so. So that's more where the split is. The educational classes are more that online kind of on demand thing. Yeah.
Are there specific services targeted for older adults?
Yeah. I mean, I would say there are some that are specific to certain age groups. I mean, like for us, ours is clearly like children, young adults, things like that. But kind of like, what did you have in mind? Like if there was like a specific like fitness class for them, or
Yeah, I think it was just a general question.
yeah, yeah.
I can just Marie, as I said, obviously since this audience is older adults, I'm just wondering if your center is separate and really supposed to focuses specifically on children, and that there is another part that older adults, maybe in terms of some of your exercise classes or art classes, or is it always integrated that it's multi-generational, or are there certain activities that because of older adults can be anywhere from 50 to 100, that there might be some other concerns, maybe advanced planning that or something else that is specific to an older adults. And I guess as part of my question, I was also wondering if people need to be patients with ANOVA. So it's kind of a two-part question.
Yeah, absolutely. That's a great question. So even though I'm pediatrics, I'm in the building with adults as well. At our family center, we have both. So there's therapists who provide therapy to adults, all age ranges, and then there's also the pediatric team here. So the same things are available to both groups, right? So we can have children's art therapy and adult art therapy. They usually wouldn't be together. We kind of practice separately in that sense, but there's adult fitness classes, there's adult support groups, children's support groups. So all of that is integrated. So our pediatric team is integrated into the adult teams. Every location has adult teams, but we're just at the Fairfax location and the Inova Loudon location. So we're like integrated into the teams. So that's a great question. Here at the Family Center, all are welcome. There are services for everyone. You do not have to be an Inova cancer patient, like Inova SHAR cancer patient, to receive our services that are the therapy, the fitness, the dietitian consults, the nurse navigation. I believe for acupuncture and psychiatry, you do have to be, because that's like, you have to be within ANOVA because of those providers, but that's because that's in partnership with those providers. And so for the most part, I would say like 95% of our services, you do not have to be an ANOVA patient. I mean, like on the pediatric team, we see a lot of people from Children's Hospital because they're really close by, and things like Children's National and things like that. So no, you do not have to be an ANOVA patient to utilize those services. And even sometimes it'll be like a limited number. If it is something that we usually say, it would be not be an ANOVA patient or something like that. So I say always reach out, because there are services we can provide if you're not an ANOVA patient. And then as far as those like offerings that might be of interest, we do have these kind of planning ahead courses, which is a lot about like estate planning and planning in advance for those things. We do have groups that are more focused on, like, it wouldn't be for like young adults, or it wouldn't be for children. It would be like for adults in this phase of life. And so, yeah, most of the time, if it's an adult class, we don't specifically say an age range, just because anyone can have that experience. But we do see a lot of people in the kind of like 65 plus, that sort of area. So all are welcome, and our fitness team can always make accommodations because they're great about limitations that people face through their diagnosis as well as through age. So they're really great at making accommodations for anyone. So yeah, and our adult therapists will see everyone. So yeah, no limits in that.
And
Great.
one of your slides mentioned brain fog.
Mhm.
So we've got somebody wanted to know, what is that and how is that related to cancer treatment?
Yeah, great question. So brain fog is what we kind of refer to of this phenomenon where oftentimes when people are on chemotherapy, the memory is not so much there. They get more forgetful. It can feel like you're kind of going through a fog. And so we have classes about how to manage that, because a lot of times that's really impactful on people's daily life. So a lot of, just kind of time management things, organizational things, as well as space for people to express their frustration with that, feeling like, oh, as soon as I started being on chemotherapy, all of a sudden I'm forgetting things, or I'm feeling kind of lost. So that's just a side effect of a lot of medications, and our team is there to support through that. So that's usually like a course that they go through that has tips and tricks about how to manage that season in their treatment. Yeah, great question.
Okay, can you expand a little bit more on what the nurse navigators do?
Mhm. Absolutely. So the nurse navigators, they are like nurses. Most of them were like bedside in their career, and then moved over to this. So the nurse navigators, a lot of times when someone might first meet them, is either at the hospital when they're diagnosed, or if they're in for treatment, or over at our infusion clinic if they're in for treatment. And the nurse navigators, they specialize in each like area of diagnosis, and so that they can provide information about kind of what's going on, what to expect with treatment. They'll kind of be privy to what medications you're planning on taking. They might be able to answer questions about side effects. If you're going to have a surgery related to your cancer, they can give pre and post-op instructions. They often teach classes about what to expect, especially like with breast cancer, because that's such a huge population that has to go through surgery. They'll teach those classes about how to manage pre and post-operation care. And yeah, they are just kind of a wealth of knowledge and helping people with those questions, and just kind of where to start, what to expect, and navigating through that. And they often do a lot of the bedside kind of check-ins and things like that if there are questions. So that team is absolutely phenomenal. We love our nurse navigators so much.
Yeah, you touched on this a little bit, but can you talk about what kind of follow-up care you provide to family members who lose a loved one to cancer?
Yeah, absolutely. So, we recognize that that is a huge chunk of the cancer population that they go through that, having that loss. So we do, have multiple services for that. So bereavement care, that can be grief and loss counseling. We do have support groups as well. So that good grief that I mentioned, we have grief circles for children and for teens if they lose a family member as well. Currently right now I'm leading our grieving parent support group, which is for parents who lose a child to cancer. So we facilitate these groups so that they don't feel so alone in that time. But we're also just there for the long haul as far as, counseling services and consultations about, especially on the pediatric end, if a parent is lost, consultations about if it seems like they're grieving appropriately or if there's cause for concern or anything like that. So we don't stop our services when treatment ends, whether that's by loss of the patient or survivorship as well. We support people through survivorship as well, because there's really a storm left behind by cancer. It's not sunshine and rainbows just after that final treatment. And so we're absolutely here to support people through those adjustments, whether their family member is still with us or not. Yeah.
Hey, how many of the activities you've talked about are offered in that beautiful building?
A lot of them. Yeah, so we're located behind behind the Fairfax / Falls Church campus. I don't know if y'all know like the big Dewberry building off of Lee Highway. We're right behind them. So we almost look like a little cabin retreat back here, but I can always pop over and walk over to the hospital if I have a patient in need. So these are just the new ones that were offered last year. Our art therapist is in this building, pediatrics is in this building. I believe most of these were online. This was in this building. I would say most of them, a lot of them, they originate here at Fairfax, just because this is where we have like a bulk of our staff, and then the other locations will get trained in facilitating that, or they might start one out at Loudon and then we're like, that's such a great program, let's bring it here too. So we all collaborate across the sites to make sure we can offer it as many places as possible to as many people as possible based on interest. But our fitness classes, like our fitness center, that picture that I showed of this right here in the top, that's downstairs in this building. So those are offered here, but they also do online things like chair yoga and online fitness classes and things like that. So quite a bit is offered here. So if you're interested in seeing this building, that would be the way to do it. This building's really great. The Dewberry family funded it, and we have like a kitchen. So I know pre-COVID people used to, before a support group, like bake up some cookies or cook and things like that. We have like our pediatric wing that has like our art room and things like that. And it's just bright, beautiful area, relaxing place to come, because we find that a lot of people, you spend so much time in the hospital and at the clinic. It's nice to have almost like a retreat when you come for these services.
One of the activities you listed was Nordic walking. What is that?
Yeah, so Kirsty Pomerinsky, she's our like fitness head, like the head of the fitness team. She developed that program where it's basically like we have like a neighborhood behind us that's like a little hilly, and it's like the walking with the walking poles, and so there's that like full body movement with that. So she would be able to explain that way better if people are interested in learning about that. But I see that group going around with the hiking poles and walking the neighborhood, walking and talking. So that's like a group activity that they do together if people are interested in getting their body moving but having that additional support. Yeah.
You know if programs like yours are offered in other places throughout the country?
Yeah, not really. We are kind of unique in that sense. There are a lot of hospitals that have like a behavioral health team or social work who do a lot of these things, but we are kind of a standalone in that. And we provide services to patients in Virginia, Maryland, DC. That's where like our therapists are licensed. But we do have people who come from as far as like West Virginia. They'll come to our Loudoun campus to see someone. Like as long as they're sitting in the state, we can provide those services. So yeah, we are pretty limited in that sense. We hear that a lot. People are like, why isn't this everywhere? Or I have a family member in another state. Could they come see you? And we do require that they be in a state where we have someone that's licensed, so that we can ethically practice. I know we do have a couple who, if someone's going up and doing treatment at like Sibley, like in New York or anything like that, we do have a couple who can do virtual sessions from New York for those special circumstances. But yeah, we're kind of standalone in offering all of these things. There are a lot of organizations that offer one or two of these things, but yeah, it's pretty cool that we're able to do that, all of this, and funded privately or funded by donors so that people don't have to, have private insurance or pay out of pocket or anything like that.
One of the challenges for cancer patients is keeping up with all of the new drugs and treatments that are coming on the market. Seems like every other day there's something different. Do you offer classes that help people understand new developments in treating their type of cancer?
Yeah, that's a great question. We typically do not do like a specific like drug education. We can like provide, links to information about things if people ask about that. But we always encourage talking to your medical team about that. And we are in collaboration with a lot of medical teams. So if someone brings up confusion about that, with permission, we can always, talk to the team. Hey, they have questions about this, especially nurse navigators, if there's questions about that. But yeah, we don't typically have like, and this is the newest drug for this or that, because we just don't know what direction things will go. And we're much more focused on the outside of that, like medical experience, and just kind of like, especially on the therapeutic end, if someone's debating using a certain treatment or things like that, more just kind of like exploring with them and helping them to reach that kind of decision with their medical team. So we don't provide like medical advice over here at Life with Cancer, but we're here to field the frustrations with all of that, the confusion with all of that, and help to hopefully put some some ease in people's minds. But yeah, we don't provide like and this week in cancer medication, this is what's coming out. We don't currently provide that. No. That's a great question.
Marie, years ago, you used to have, and maybe you don't anymore, you used to have cancer-specific support groups.
Yeah.
And that, I guess that was kind of, I was trying to prompt you to talk about those, because I know that in those groups, they did talk. I know that when I got on to them, sometimes they would talk about, what was presented at ASCO or what was presented. So I guess that's what I wanted you to talk about, was those cancer-specific support groups.
You handed it to me on a platter, Carolyn, and I looked over.
No, it was probably clumsily worded.
No. So yeah, so in those specific groups, there is space for people to talk about their experience, answer those questions within there with people who are specialized. We don't have like a new to cancer drugs this week sort of thing in general, but we do have support groups for specific diagnoses like skin cancers, like breast cancer, prostate, things like that, where then that's a space where they could come together and kind of field those things. And usually they're led by a therapist and a nurse navigator, so that a nurse navigator would be able to speak to the more medical end of that when questions come up, but it depends what that group is looking for at that time. Yeah.
Okay, next question is, you mentioned research activities, and I wanted to ask you to talk a little more about what those are focused on and how they're conducted.
Yeah, so that is a great question. That I am a one, which means I am new in the realm of things. So we have people who have been working here much longer than me, have expansive careers, who we're all encouraged to do so, to do research in the oncology field. So I know people have done research about, specific therapeutic interventions for specific diagnoses. I know that people have presented on things like music therapy, on art therapy, on, you know, specific support groups that were developed here. Like we have our Mind Over Matter program, that is fantastic and required a lot of research. So it really just depends what any given staff member at any time is feeling passionate about. And we're always encouraged to do it and present at conferences and things like that. Our research isn't so much like on our Life with Cancer team. It's not like finding the cure for, or, you know, it's for therapeutic interventions, fitness interventions, acupuncture interventions, and how they can benefit oncology patients. So we're constantly trying to be at the forefront of what is appropriate for supporting these groups. So that's a lot of what like our research goes around. I know that's a very like general answer, but it's because really the world is our oyster as far as research over here. It's highly encouraged for us to constantly be trying to find the best practice.
I would just follow up on that one, Marie. This is Cheryl
Mhm.
again. I was just wondering if then you, in terms of these research activities, do you work closely with like NIH to you know, get more funding and make it more of an official type of a research study, or is the research done just internally then with staff members there? How does that work?
No, there's definitely partnerships. I do know that there was a study recently that did involve NIH, and I don't remember the name or like who was doing it. But there's definitely like partnerships with other organizations, other hospitals, universities, things like that. So we're definitely not in a silo for those things. Yeah, or a vacuum. Yeah, we definitely like to collaborate because we know there are a lot of great minds all around us.
Okay, thank you.
Yeah, thank you.
All right, well, I don't see any additional questions yet, so anybody that's got a question or a comment, now's the time to weigh in.
Yeah, and I just wanted to pop up here kind of more of the contact information. I'll put also that inbox, Life with Cancer at Inova.org. If they offer consultations through our team, so if you think Life with Cancer might have a service that would be appropriate for yourself or a loved one, we do ask that you don't call on behalf of someone unless you're a caregiver. So not like, hi, I'm calling to set up therapy for my friend who I heard has cancer, but more like if you're the caregiver, doing it on their behalf, or for yourself as a caregiver or a patient, or a family member. If you reach out to Life with Cancer at Inova.org, we have people who can have conversations with you about what you're looking for, what that support might look like, and do kind of intake from there. On the pediatric end, put that in there. If you know of a family that's impacted by cancer, LWC Peds for pediatric, that's the inbox. However, if you sent anything to either of these inboxes and it ended up at the wrong place, we all talk to each other and it'll just get sent to the right place. So don't worry about that. But you can reach out to either of those emails or LWC Peds. You know, for those referrals, that event website that I put up, as well as our website that's here, lifewithcancer.org, is a great place to go for more information about our team, what we're offering. While we have great programs offered all the time, everything isn't offered every season because, well, staff capacity, room for these things to happen. So you can also check out the calendar there to see what's upcoming and register if there's a class that's appropriate for you.
Oh, Maria, I did one more question. If somebody suspects they have cancer, a woman finds a lump in her breast, for some other reason they suspect they have cancer, and they don't know who to go to or what to do, can they call you and ask for some direction about, I don't have a doctor, can you help me find one? Or is that outside of your purview?
Yeah, that would be more like before anyone met us. We do definitely get where people are like waiting for pathology, waiting for answers, talking to people about the anxiety that surrounds that. However, on Inova.org, they just redid the website where it's like, if you're looking up these things, they have all of the providers listed with like profiles and things like that, especially Inova Shark Cancer. So we highly, highly recommend going on there, making an appointment, and then from there, if there's thought that a diagnosis would happen, that's where we would be brought in. Yeah, that's a great question. Because yeah, it's scary and concerning, and we definitely want you to get care as soon as possible.
So Marie, one question that I had was, where physically is this program, and does your organization provide any transportation, or if anybody needs to use your services, must they provide their own transportation?
Yeah, excellent question. So we provide physical services at, I believe, just about every Inova campus. I think Mount Vernon might be the only one that we don't currently have a staff member there, although that may be changing because we're always growing. And so with like transportation, it's not required that someone has their own transportation. Through Inova, we do have a great team of social workers who can help with figuring out transportation, whether that's through Uber or through, we have like a shuttle service that goes from like the Shar campus over to the Fairfax campus and things like that. So there are resources there. So if people don't have a ride, our social workers who work with Inova and with Inova Shark Cancer are great about coordinating that. I know for our patients, we do have some ride assistance when needed for adults. So that can be coordinated and things like that. So it's not like if you can't get here, we can't provide services. We always try to find a workaround for that before reverting to possibly doing those services at a location closer to someone or virtually if that's what's needed at that time, if accommodations can't be found. So is not a disqualifier if you can't drive or don't have a vehicle or anything like that. Yeah.
Okay.
Yeah. Great question.
And of course, ANV provides transportation to members. So that's a possibility. That's probably the biggest service that we provide is getting people to and from doctor's appointments and other things like that.
Right.
Yeah.
Right.
I've definitely mentioned y'all to people who are in the Arlington area. I've asked if they know about you, if they're a part of you, and offered that up. So I know that our social workers are aware of like local organizations too that provide that. So same here, if you're hearing someone say, it's hard for me to get to appointments, those sorts of things, that's such a huge help and such a big relief off of their shoulders to just know that that's taken care of. So we really appreciate you providing that for the members of your community. That's awesome.
One thing that I was just wondering also is that, seems to be a very unique place in terms of cancer patients. Is there any challenges that you find, or that ways that you'd like to yet improve or provide something that isn't being done right now? And what does the future look like for these kinds of programs?
Yeah, I think we're, like I said, growing. The team is just like growing exponentially all the time and expanding. So that's a great thing. Since we are a free service, I think a lot of times the thing that free services come up against is those wait lists. We don't have a long wait list right now because we do have a large staff and we are short term. So we make sure to honor that so that we can be sure to serve as many people as possible. But all of that is done through donor funding. And so without that funding, we couldn't make this possible. So we're very grateful for our donors and for everyone who supports us. I would say the biggest challenge is just there are so many people that we want to help, but we only have so many hands, which is why I'm really excited that the volunteer program is getting up off the ground post-COVID. It did have to take a pause during that time. So that's a huge thing. It just takes a lot of hands. I think that we're all just people who want to help as many people as possible. And as a free service, that can mean getting inundated at times. And, you know, we take that head on because we want to help as many people as possible. But, you know, the more funding we have, the more donations we have, the more that we're able to address those things. So, yeah, I love it here. I love working here. I love our mission. It's a really great place to be as a clinician as well. I just really feel truly, I believe in the mission here, and that I'm treated well as a clinician. I have balance and all of those things. So I think that also gets buy-in from our staff, right? Like we want to be here all the time helping everyone. And that funding makes it possible as much as possible. Yeah.
And you're,
Marie, go ahead,
ahead.
Cheryl.
no, I was just going to ask, you do not have volunteers. Everybody is a paid staff member in terms of providing the services. Is that correct? There's no
Well,
volunteers.
we have volunteers, yeah. So
Okay.
yeah, recently we just got some volunteers to be like front desk staff coverage. So on certain days of the week, because our operations and administration team, they are just like some of the hardest working people on our team, and they have so much on their hands, and they want to be able to be a welcoming face when someone walks in, but there's so much going on. So we have some volunteers to also help with that, particularly over the summer, when maybe like there's less staff that's able to like hop on the desk all the time. A lot of our fitness instructors are trained volunteers. So they go through like training or requirements that Kirsty has for whatever class that they're teaching, and they're volunteers as well. So we do have volunteers on the team. And we're hoping to open that up even more as we expand. So if you're interested in offering any sort of gift or time or talent, I would definitely recommend emailing lifewithcancer@inova.org, and then our volunteer coordination team might have a spot or have an idea or say, wow, that's a really great idea, we should do that. We love collaborating with volunteers. Yeah.
Carolyn, you had a question, and then I had
Yeah,
another.
you mentioned that you work primarily with the doctors over at the Shar Cancer Center. Do you also work with other groups like the Virginia Cancer Specialists or other cancer specialists in the area?
Yeah. So, I mean, that's just more specifically because I'm here at the Fairfax campus. That's like literally right across the street from Shar. But yeah, we are in collaboration with a lot of, since we're not Inova specific, you know, collaboration with them. So it's not like we're like, we won't talk to their doctor, but you know, get permission to do that, or if they're interested in that, you know, collaboration or anything like that. But yeah, we don't like shun anyone who's not using an Inova Shar doctor or anything like that. Yeah.
And I had one other question too. It occurs to me that obviously people with cancer may be in remission, but may not be in remission. Do you have any kind of relationship with hospice care? Is that part of the whole routine or regimen that's provided, or is that a separate thing, or how does that work if it is obviously that somebody does or eventually would need hospice care? How does that work?
Yeah, so hospice is definitely a big part of cancer. A lot of people do end up going into hospice to have comfort care at the end of their life. And a lot of times we're helping families just navigate that decision. We're not making decisions for them. We're not referring them. That's like on their doctor and their medical team to see what fits best with them. But Life with Cancer, it's a lot of conversations about what does this mean for us, you know, more like on the therapy end. My experience has been a lot of just questions about like, is this what we should be doing right now? And just kind of guiding them through that conversation, not so much advice giving, but processing. And it's more like what Life with Cancer would do. We can answer practical questions about like, what does hospice mean and things like that. But yeah, it's something that we just kind of help people navigate. We don't make decisions for them, but we help them with that difficult decision for sure, as far as just
Okay.
slicing out their own thoughts about it. Yeah. Yeah, it's a great question.
So you've talked a lot about the classes that you've offered, helping people understand, you know, where to go and what to do and what to expect. Given all of the unscrupulous scam artists and con men out there who would love to take advantage of somebody in a vulnerable position. Have you ever done any kind of classes on, what not to do? Don't buy this service, don't pay for that device.
Hmm. That's a great question. I don't think we ever have. It might come up as like a question in those one-on-one groups that I have not been a part of those conversations. And maybe other people in the group say like, oh yeah, that was a scam or things like that. But I don't think we've offered like these are the scams going around sort of education before. That's a great question. I don't think that we have. I think a lot of times like the doctors are speaking to those a lot more in the appointment, and things like that, but that's a great question.
A lot of times questions like come up with a doctor because the patient will say, I heard about this great drug X, Y, and Z, and it's, some veterinary drug.
Right. Yeah, and I think our dietitians come up with a lot of those conversations because it'll be, oh, I saw that this diet could be curative, or I saw that eating this thing could be curative. And so the dietitians, I would recommend those would be the people to have a consult with if it's about ingesting anything and the impact that might have on cancer, because they are very knowledgeable about what has scientific backing, what's backed by research, what is not. And they're very gentle guides on that. They're very respectful of, people are just trying to beat this, right? And they have good hearts with that, trying to do their own research and trying to find those things. So they're very understanding of that and willing to have conversations about that with people. Yeah.
Anything else, Gary? I guess we are now about
Uh,
5 minutes before.
Oh, wow.
Yeah. So, yeah, if anybody's got final questions or comments, now's the time to weigh in.
I don't hear anything. So if that's the case, well, we certainly want to thank Marie Calle for her presentation today. That was absolutely fabulous and provided a lot of information. In fact, since I also do Aging Matters, I may be following up on this. This is very helpful, and it might be a future topic for a radio show. So we'll see what develops. And but in fact, interestingly, I had a woman who was on Aging Matters and also spoke very highly of the Shar Center. So I had heard of it before. So this was very helpful to learn more information. So thank you, Marie. This was an excellent presentation.
Thank you.
Thank you all so much. That time flew by. I loved talking with you all.
Okay.
And
I'm glad you knew about us before
Oh,
we even
yeah.
from your
I used
grandparents.
to, I was telling Gary, I used to spend summers over at the Arlington Forest pool. So that might be some of your pool too. But thank you so much for having me. Like I said, just even if it's something our team can't help with, we're happy to answer questions and point you in the right direction. Just everyone here is so helpful and so passionate about what they do. I cannot speak highly enough about all of my colleagues. Like, no kidding, they're great. And so even if a question comes up that's general, I would say hit one of those general inboxes and someone much smarter than me will probably answer your question. But if you have a question about something I specifically talked about in this presentation, or about pediatrics or anything like that for families, you can also feel free to email me directly. You probably could have guessed that email. It's first name, last name, but yeah, that's there if y'all need it.
Excellent. Well, as I said, the woman who was on Aging Matters spoke very highly of the Shar Center in terms of the treatment for her cancer. So, so you come highly recommended. So,
Well,
thank you. Thank you. So we're almost out of time, and just reminding everybody who is still with us here that next Wednesday we'll be hearing about Road Scholar. So, and I don't know how many folks have traveled on some Road Scholar trip. I actually have, and maybe others have as well. So really we'll look forward to Kelly Aspey, who is a Road Scholar ambassador, who's going to talk about the programs, and especially since obviously Road Scholar is for older adults. So that'll be 10 o'clock next Wednesday on May 8th. So look forward to hearing from her. And until then, have a good week and enjoy your first week in May in this wonderful warm weather. Not too hot, but just right.
Bye-bye.